So you will be finishing with the...
When I finished my training as a GP in Spain, the British Council approached us and they were recruiting GPs to come particularly to the northeast, and I thought it would be an opportunity to know a different healthcare system and to work in the UK. And my plan was to come for 3-4 years at the most, and 12 years on the line. I'm still here, 13 years on the line, I'm still here.
What's wrong with it? I lived around here to begin with, and I went away and I've worked all over and I've ended up coming back, so that says something. If you ask anybody what they would like, they'd like to say, I would like to see my own doctor. What we've got here is we've got families coming right through all generations, from when they're born right through to when they pass away, and we look after them all the way through.
In terms of general practice, which is mainly my vocation, is the possibility to offer continuity of care, to know the patients, to know the families as well, and the variety of consultations, which is the main thing of general practice, that you never know what is crossing the door.
It was a very industrial area with the steel works and the chemical works, and they've all disappeared now, but the inherent health issues that they bring, such as cancer, chronic disease, diabetes, asthma, COPD, they all maintain. We are very lucky here because we've got a group of patients that actually come to see us because they've got medical problems, rather than the worried well that you might have in some more affluent areas.
I also like the possibility to work as well as a GP with a special interest, so I have done further training as well since I live in the UK, because it gives you like a variety, it gives you some form of portfolio. I also have worked as a hospice physician, so that makes the whole work really more challenging and more interesting, more stimulating. I think that's one of the most important benefits really in terms of professional satisfaction.
We're lucky we've got James Cook Hospital around the corner as well. James Cook is pioneering many aspects. Doctors do work very closely with us, and they always will discuss things. I think the general feeling is that we're very well supported. I often need to get advice, and there's always somebody on the end of the phone, and I know that advice is the advice that I can trust.
We do meet now and again as well for educational events, which I think it is very important that we know each other as well. We work together and we support each other, so there are different groups as well that allow to do that, and it's nice to know your colleagues.
There's a very good close-knit group of Teesside doctors, and we meet up quite regularly at conferences, medical events, training sessions. There is no competition between anybody, which is one of the good things I like about this area. And within the medical profession around here, from the consultants down to the GPs, there's always a camaraderie, there's always help. We all seem to want the same things for our patients.
13 years on the line, coming from Barcelona, big city, completely different area. A lot of people ask me, why are you still here? First of all, because of the professional satisfaction, the possibility of work also as a GP with a special interest, having a varied portfolio as well. I think we are blessed, we can enjoy the best of everywhere.